Dr. Robin Berzin, I'm very, very excited to talk to you today. You know, we talk about gut reaction, and it's such a reality. And, you know, for the past 40 years, I've been in this field of looking at psychoneurobiology, and I'm sure you're familiar with Candace Pert's work, one of the leaders in the field who back in the 60s already was talking about how important it is to link. And, you know, it's not just in the brain, it's the whole, we've got to look at the whole entire brain and body. So I'm very excited to interview you about your work and what you do, and your newest book, which is, I'm going to make sure I get the name right, Prescription for Happiness, which is out now. I'm very excited to talk to you about all of this. So welcome to my podcast.
Thank you for having me. I'm super thrilled to be here.
Oh, that's wonderful. Well, tell us a little bit about, first tell my audience a little bit about you and what you do and Parsley Health and why you wrote this book, and then we'll dive into some details.
Of course. Well, hi, everyone. I'm Dr. Robin Berzin. I'm a physician trained in both internal medicine and functional medicine. I'm also the founder and CEO of a company called Parsley Health, which is the world's largest functional medicine clinic. We're available nationwide, and we are really here to help people diagnose unexplained symptoms, treat chronic disease, and even reverse chronic disease and optimize their health. And we do that for folks all across the United States. We're not international yet, but focused on the US. I'm also a New Yorker, a mom of 3. I have 3 kids, 7, 4, and 2. I live in Brooklyn, and, you know, I'm just incredibly personally passionate around health, mental well-being, longevity, and health optimization. So I'm excited to be here today.
Oh, that's wonderful. You know, one of the things I love about your work is that you do reflect. I interview so many interesting people on this podcast and have met in the field that I'm moving in, so many really forward-thinking doctors. And I'd classify you in that group as a physician who's aware that we need to not just look at the symptomology of the physio of pure brain and body, but to actually look at the whole person. And, you know, you say, you're a functional medicine doctor, and a lot of people hear that. They hear, and there's the whole well-being movement. So people are much more educated when it comes to holistic practice of looking after themselves. But I've heard you say a few times that, you know, people still need a lot of education around this area and still need to learn to advocate for their health. And you seem to do a lot of that in how you approach things. And even in your book, your angle is very much about enabling people to know more about what to go to their physician with and how to recognize things inside of their body. Could you talk a little bit about this need that we have to just take more ownership and understanding and control of our mental health, and not think that the doctor's the god, but that they know obviously more than we do about specific things, but how important it is to understand more about how we function?
You know, 99% of our health is happening in our lives, not at the doctor's office. And we have incredible power and influence over how healthy or sick we are. And yet we've all sort of been schooled to feel like health is something that you wait till the wheels fall off the wagon and then you go to a doctor and ask them to deal with it. And that's not true. We learn how to tie our shoes and brush our teeth, but we don't learn how to create and generate health and well-being in our minds and bodies, even though that's something we all have the power to do, regardless of our genetics, regardless of our environment. We all have that power. And so what's really gratifying in the work that I do in seeing patients and also in having, you know, built this very large clinic that sees patients virtually across the country, is that we're able to not only treat people's disease when they come to us for depression or a GI issue or autoimmune disease or trouble getting pregnant or hormone imbalance, blood sugar issues, weight gain. People come to us for everything, and we treat those conditions in a holistic way. But what also happens when you work with us at Parsley Health is you learn about your body. You learn about the foods that you need to eat, the way that you need to move, how you can manage stress, the supplements you might take, and the ways in which your environment is impacting your health every day. And I always say that being a Parsley patient is kind of like going to medical school a little bit, or going to health and wellness school, let's say, maybe not medical school, but health and wellness school, because whether you stay with us for 5 years or 1 year or something in between, you ultimately really understand how your body works and what makes it tick. And I think that's something that we all deserve to know.
Oh, that's brilliant. It's so important. And I know you're a big advocate of women's health. In fact, one of my questions that I wanted to ask you is about how a lot of women don't really always, deal with their physical health or their health in general quick enough. They kind of leave it and push it to the side. And, this is an issue, and you did a very interesting survey on, gut issues and women and everything. Could you talk a little bit about women and our health and how we should be a bit more proactive?
It's so interesting because women are the CEOs of our healthcare system. They actually drive 80% of healthcare spend in the United States. They spend $85 billion a year more on healthcare than their male counterpart.
Wow, I didn't know that.
A fraction of that is around pregnancy and maternity. So it's really across the board. They're disproportionately impacted by autoimmune disease, by GI conditions versus men. And yet, women in the white paper, and we commissioned a survey of 1,200 women in the workforce ages 18 to 60. And what we found was really astounding. Women are, despite being the drivers of healthcare spend, they're frustrated with the healthcare system and they're not getting what they need. 80% are delaying care. Number one, because of time.
Wow, that's crazy.
They don't have time to go to the doctor. And in fact, data shows that women will kind of take everybody else to the doctor, parents and partners and kids before themselves. And they're working, they just don't have time. The second most common reason they delay care is because they feel like they go to the doctor and they're dismissed, they're unheard, or they're told to just take another pill. That was the quote we got over and over again in the survey.
Wow.
And so they feel like they go, and actually 66% said they don't have a clear diagnosis for their symptoms. They're experiencing symptoms, they're going to the doctor, and someone's telling them that it's all in their heads or not giving them a clear diagnosis.
Well, that heads thing is actually really true. That whole mind-body link. I didn't mean to interrupt you there, but it's a derogatory term that they use it in a derogatory way, but actually it's such a truth. It's shockingly, frighteningly true.
It's absolutely true. And it's said to women all the time. I had a patient who was experiencing weight gain and constipation and brain fog on testing, had high cholesterol, and she'd been put on an antidepressant. She'd been put on a cholesterol medication. She'd been put on a blood sugar medication. No one had properly tested her thyroid. And 1 in 5 women in her lifetime will be diagnosed with a thyroid condition in the US, most of it low thyroid function, of which the symptoms are slow digestion or constipation, weight gain, high cholesterol, brain fog, fatigue, depression. And, she was put on an antidepressant, which did absolutely nothing for her because she wasn't depressed. It wasn't in her head. She ultimately
created other issues.
And no one had tested for that was easily treatable. And so what I see over and over again is we tend to, in medicine, be a little bit reductive out in the medical community. We assume that we have the answer. And because unlike those of us who are taking a root cause approach to medicine or a functional approach to medicine, call it, most are, 15-minute visits. They have to do the most basic tests. They're really not looking at the whole person. They're not trained. Our doctors in general are not trained to look at what someone's eating, how they're moving, their relationships, how they manage stress, their environment. All of that is determining your health, not just 20 years from now or 6 years from now, but right now. And yet our medical community at large doesn't even look at any of those factors in assessing what's going on with a patient. And so we heard this loud and clear from the women that we surveyed, the 1,200 women that we surveyed in this white paper that we generated, that they're just not feeling heard and don't feel that anyone's kind of looking at that whole person. And when you do take the time and you are trained, we have an in-house fellowship at Parsley Health that trains all of our providers in root cause medicine. We're able to connect the dots across different parts of the body and different parts of your life. And that connecting of the dots can be the roadmap to healing and better health.
That's absolutely amazing. I love that. I've also heard you talk about the root, going to the root, and that really got me excited because in mental the whole psychoneurobiological approach, if you're going to help someone with their mental health, you can't just go and say anxiety is a symptom of a disease, which is not even science. It's been disproved. Seeing it just as there's something wrong in the brain. You have to go to the root cause. You have to see that as a signal, how you show up, and you've got to go and find the root cause, and you could deconstruct and reconstruct. So when I heard you talking about the root, I thought, here's someone who's after my own heart. Speaking is in my wheelhouse because very few doctors really that I have, obviously I shouldn't generalize, but there's not that many people in the medical profession that talk about getting to the root and connecting the dots. And that's very unique about your approach, which is really why I'm very, very excited to interview you. Could you talk about this concept of connecting the dots a little deeper and why we need to go to the root? I love that.
Absolutely. So, brain fog, for instance, is on the rise. And I'll use brain fog as an example here.
Good example.
Brain fog for many people can have many different root causes. And we see over and over again that, first of all, brain fog is dismissed as sort of like a non-serious symptom, even though it's horribly life-destructive,
Exactly.
disruptive and destructive to feel like you can't focus or think straight. And when we look at brain fog from a root cause approach, we see the following. Brain fog can have its roots in a high sugar diet. When you eat a high sugar diet or have metabolic syndrome or diabetes, as over 2/3 of Americans do, many of them undiagnosed, you actually have inflammation in the brain. And when you have brain inflammation, you have brain fog. So high sugar diets, diabetes, metabolic syndrome, one cause. Another cause has shown to be long haul COVID and perhaps the disruption to the gut microbiome that folks who are impacted from COVID beyond the initial infection have had. And we know that the microbiome in general is incredibly important to our brain health and our brain function. 95% of the serotonin in your body is in your gut, and our gut microbiome, or the bacteria that live in our gut, are a really key part of manufacturing neurotransmitters like serotonin, GABA, that then travel through the gut lining and to our central nervous system. So your gut microbiome could be a reason. It could be disrupted from COVID. It could be disrupted from drinking too much alcohol. It could be disrupted from also eating a high sugar diet or taking too many antibiotics. Some people have a condition called small intestinal bacterial overgrowth. This is a long established condition. We have tests for it. And yet only last year did small intestinal bacterial overgrowth, or SIBO, get entered into the medical system having a diagnosis code, what's called an ICD-10 code, which is crazy because we've been treating it. This existed for years, but you didn't even made it documented as a condition.
I didn't know that. Sorry to interrupt you. I didn't know that. But I've been talking and hearing about SIBO for 10 years. So you're saying it's only just been...
It's just recognized by our medical system after intense pressure, gastrointestinal community, from the functional medicine community, from researchers at Mass General, which is part of the Harvard system, who are some of the folks who've done the most research on SIBO. It's incredible to me that you sort of had to fight that hard to get it in, but it exists and it's real, and it's a top cause of SIBO. Nutrient deficiencies could be causing brain fog. There's lots of different root causes. And so a thyroid condition could lead to brain fog. And so we have brain inflammation, we have microbiome disruption, we have nutrient deficiencies, we have sleep deprivation, right? If you're poorly sleeping, I know so many moms like myself, right?
Yeah.
I think I was up every hour last night because my littlest has a cold and he was coughing, but if that's going on for you for months, sleep deprivation can mask as depression or brain fog. And so the point I'm trying to make is that there's a number of different root causes of brain fog. If you try to therefore treat brain fog as if it's in the brain through stimulant medications, such as ADHD drugs, which are often used to treat brain fog off-label, those medications create dependency, they create sleep disruptions, they create GI dysmotility, so you end up with SIBO and constipation and other GI issues because of being on those medications. So there's not a free ride in taking these medications. Not at all. People get used to them, then they have to go off them, they crash. It's an absolute mess. Horrible experience. And none of that is treating the root cause, nor is an SSRI or an SSRI, which we see too often very well-meaning psychiatrists and primary care docs and neurologists, people on these, SSRIs, SNRI classes of medications. These are like the Prozacs and Zolofts of the world. They have absolutely no impact on brain fog. Why? Because you weren't treating the root cause, which was microbiome, which was blood sugar. By the way, none of those things are things that the psychiatric community typically assesses for. And so the reason I wrote State Change, Prescription for Happiness, which is my book all about the physical drivers of our mental health, is that I wanted to shed a spotlight on how often our mental health is starting in our bodies and how often that gets missed. And how I see so many people get stuck when it comes to mental health because they're treating it as if it's in their heads when it's really starting in their bodies.
So what I love about what you've just said, amongst a myriad of different things, is that there is such a strong move at the moment to do nutritional psychiatry and to look at nutrition, and that's great. But you can't just slap on a supplement as a Band-Aid. It's the same kind of approach as an SSRI. And we know that the SSRIs, most people don't realize how something like an SSRI and SNRI can change brain health and body health and have all those things that you're trying to treat in the first place, and how it's such a quick go-to. But we can't just take something external and slap it on. What you're doing, which is what I try and do with my approach from a mental health side, is let's see why you're showing up like this. And that is so important. So what you said also is really key, and I want to make sure my listeners heard this, is there's a feedback loop that's being set up here. So because I talk in this podcast and my research a lot about the mind-brain-body connection, which I know you talk about as well. And it's mind-brain-body, mind driving everything, but the body feeds back into the mind. And so we've got this constant feedback loop. So you're really dealing deeply with the physical root causes. And you're so right. If there's any kind of increase in, we've shown in our research, increase in homocysteine, it's going to be very closely linked to depression and anxiety and, all these things that are logical, but not spoken about sufficiently. So I love that you have
medical system until now that's been designed to look at those things, right? Really the root cause medicine approach, also known as functional medicine. At Parsley, we call it root cause medicine. And we call it that because everyone can understand that, right? Why would we not?
Yeah, it's great.
Cause, right? And when we do that, it is such an unlock. It's amazing because you could take someone who's experienced all these symptoms, get them off of all their medication, have them stop seeing all their specialists, and really have them feeling like they're 20 years younger, just because you took the time to really pinpoint exactly the root cause of what's going on. And it takes a little bit more time. It takes a more advanced approach to diagnostic testing. We actually built our own fellowship at Parsley to train all of our doctors and nurses and health coaches.
That's amazing.
There weren't enough providers out there who were trained this way. So we train them in an evidence-based approach to root cause medicine. And then this means that really anyone can have access to this type of care. What I'm excited about is that this type of care is really growing in recognition. It's coming out all over, and people are starting to understand that I don't have to feel this bad. I could feel better if we treat the root cause.
Can you, that's so true. Can you walk us through, like, if someone, what does it look like to experience your kind of approach? As you said already, as you described, the traditional thing that we were used to, 15 minutes in and out, basic testing, looking at the most obvious symptoms and not really doing the work. So that's going to take a lot more time, what you're doing. So what does it look like?
So, in this type of medicine, we at Parsley start with a health risk assessment. So you sign up online and we ask you a bunch of questions. And these questions are not questions that probably any other doctor has ever asked you. We ask you what you're eating and how you're moving and how you manage stress. Like wine and sleeping pills will lead to a very different health outcome than yoga and gardening. Your doctor need to know that. We ask you about your relationship with technology. Are you sitting and looking at a screen 10 hours a day? Well, now we know you're sedentary and you're staring at a screen, both of which are going to have implications for your metabolic health, your mental health, your musculoskeletal health, right? So we understand how you're living. We also go way back in time. Today in medicine, doctors have so little time and they're trying to do everything so quickly. They try to focus on what's right in front of them. And oftentimes these conditions we're dealing with today, these chronic conditions, these conditions develop over years, if not decades. And so we'll actually go all the way back to how you were born. Were you born vaginally or C-section? What was your childhood like? Where did this come from? I'll hear patients say, I developed brain fog like 3 years ago. And instead of being like, you have brain fog, here's a medication, we'll say, well, you developed brain fog 3 years ago. What was happening to you 3 years ago? Oh, let me think about it. Well, wow, I was living in this other place and I had this other job. And did you take any medicines? Were you treated for any conditions? Oh, you know what? I had a lot of sinus infections then. I took a lot of antibiotics. And then I know, because I'm trained in root cause medicine, when you took a lot of antibiotics, you probably really messed with your gut microbiome if you took repeated courses of antibiotics. And then you tell me you've brain fog, but you also have bloating. So now I'm like, you know what? I think I'm connecting the dots. I think you have SIBO, or small intestinal bacterial overgrowth, which could be causing your brain fog. And then I can test for that. And then if I show that you have it, I can treat it. Right? So the way that it works is we do this really deep health risk assessment online. Then you spend an hour with your doctor online. And that hour is really about reviewing that health risk assessment, connecting the dots, making sure we've got the full picture of your health, and getting to know you as a whole person and hearing your story. We're all taught in medicine, I was taught, I trained at Columbia and Mount Sinai, two amazing places to train in medicine. And I remember in my medical school training, they told us all the time that the clues are in the patient history. Listen to the patient history. They told us that in medical school, but then out in the real world of medicine, that doesn't happen. There's no time to listen to the true going all the way back patient history. So we spend that hour with you. We really hear that story. And then we order the right tests. So we're leveraging root cause diagnostic testing. And these tests are not necessarily fancy tests. These are tests that you could just go get at your regular lab in your local lab. But it's blood work that your regular doctor usually isn't ordering. And we do about 100 analytes in our first round of testing, as opposed to 19 analytes, which is what your average, PCP is doing. And we're doing that because we're looking at things like homocysteine. We're looking at things like thyroid markers. We're looking at nutrient deficiencies. We're creating data set of your baseline health. We call it the Parsley baseline testing. And this baseline testing gives us that full picture, allows us to really connect the dots across the body. And then that plus our intake and our time with our provider allows us to personalize your health plan. And then when you get your prescription, instead of it just being like, here's a prescription for a pill, we will do that. We will prescribe drugs, and medications and pharmaceuticals are deeply important and we need them. And so I want to make that clear. This is not about a natural approach at all costs. This is about the right approach. And so
combination.
Combination. So we'll prescribe drugs, but we're also prescribing a highly personalized nutrition protocol, sleep protocol, fitness protocol, supplements. And we're doing that based on the health risk assessment, the provider interview, and the laboratory data, which no one else is doing.
No, that is fantastic. I love that. Thank you for explaining that so well. And this, the book that you've written, can you tell people about the book and how's that going to help them in terms of their own health?
So the book is as if it's DIY for sort of everything I just said that we did at Parsley.
That's how I wanted you to just sort of move through.
Yeah. And so, we have a self-assessment in the book where you can kind of track your own symptoms. And we have a lifestyle self-assessment in the book that you can write down and really pinpoint for yourself, hey, what's throwing me off? We call them core actions. And so we help you self-assess your nutrition, your movement, your relationship with technology, your relationship with substances, right? Alcohol and other substances, for a lot of people, are Achilles heel and are often started because people are looking to deal with mental health symptoms, but then they can become the cause of mental health symptoms. And so we help you self-assess this across all of these different domains. Exercise, are you moving or are you sedentary? And by really it sounds all so simple, but we really line it up in an easy way that anyone can do. And they can just sort of self-assess their symptoms, self-assess their core actions, their core lifestyle actions, and say, all right, where am I off? And then we walk you through in the book the ways to modify all of those factors, including recommending specific supplements. And we list the specific diagnostic tests and talk about them. And you could literally rip a page out of the book and take it to your doctor and say, order these tests.
That's amazing.
Sort of a roadmap.
That's absolutely fantastic. Thank you for doing that and for explaining that so well. And it is something that, they can do this and come directly to you as well, but it's going to, you're teaching, it's great because not only are you helping someone with their physical and mental health, but you're giving them the tools to be more empowered. And we know, and I know from my research, the more empowered and the more autonomy you feel, the quicker you're going to start moving into a space of healing. So this kind of work that you're doing is vital. And to have the book as well, which is really fantastic. I would love to talk a little bit more about gut health. And because I know that that's one of the areas that you speak a lot about. And as I said at the beginning, I'm excited about this because I wrote a book, I think it was in 2017. And I dedicated a whole chapter it was called Think and Eat Yourself Smart, the book. But there was a whole section on gut brain health. And in that stage, it was 2017, that was quite new for people to be talking about that. And it was, and I remember doing interviews about this, and now people are talking about it all the time, wellness doctors and so on. But I love your approach. And I think it's expanded. We know so much more now about gut brain health. And I like the fact that the way I've understood how you approach it is that the brain is not it. We've had so much work in this 40 years I've been in the field. There's been so much emphasis on the brain, which is great. We've learned so much about the brain, but the brain is not doing everything. The brain is part of the body. And our immune system and our gut and everything are all where memory is also residing, and it works together as a unit. So I'd love you to dive in a little more to the gut-brain connection, the two-way street, and how you explain it.
It's so cool. We don't think about our guts very much, right? They kind of do what they do and we trust that that's working well, right? But when you think about it for a second, your mouth is an opening to the outside world, and all of the foods and drinks and medications and everything you take in is the outside world traveling through you. And then your gut has to break all of that down into microscopic pieces, get rid of what it doesn't need, absorb what it does need, and use that for energy and information. So it is just this absolutely incredible thing. We also have something called the enteric nervous system, which is 500 million neurons. So your brain and your spinal cord, which is your central nervous system. And then you have all the nerves that go through your body that innervate your organs and your muscles and your skin. We know about those. Those are the peripheral nervous system. But if you think about back to biology, probably no one really taught you about the enteric nervous system, which is third nervous system, which is this massive nervous system in your gut. And that, again, has to be there because your gut is your second brain. And as I said earlier, 95% of their serotonin in your body is in your gut. So when we think about that concept of a gut feeling, right, it is really true. We evolved as beings, as living life forms, to need to survive. And so that power of your gut and your hunger to drive your decisions through life evolved not just to make sure that you eat food and stay alive, but to be really, really intelligent. And to be extremely intelligent in a symbiotic way with the bacteria that are also in your gut, which we need. If we got rid of all of those bacteria, we wouldn't be able to digest our food. We wouldn't have neurotransmitters. Our immune systems would go haywire. And so as we've learned about this over the past, many years, but I think become popularly aware of it in the past 5 to 10, we now understand that what's happening in our brain starts in our, and that the foods that we're eating have tremendous impact on our mental health as a starting place, starting with the outside world going in. We know that, for example, that gluten, which is a protein in wheat, for many people is very destructive to the gut lining, is very triggering to our gut immune system. 70% of your immune system is in your gut, which you can imagine makes sense. If the outside world's coming through your gut, your immune system has to be on guard, right? It has to be ready. Can't sort of let anybody in. It has to be ready to fight if you have an infection or a pathogen coming through. And so that immune system that then gets triggered by gluten leads to an inflammation cascade through the body, which many people experience gluten sensitivity not as a gas or bloating or sort of GI symptoms. No, they experience it as brain fog, anxiety, depression, and anger and irritability, or metabolic symptoms like weight gain, skin rashes, because of the impact of the immune system. That's one example. I always talk about gluten because, it's come about popular culture. Gluten sort of got labeled as really bad. And now we have the backlash to that, which says, well, this whole gluten thing is silly. And it's not silly. For a lot of people, this large protein subunit in wheat is highly toxic to the gut lining and highly triggering to the immune system. Now, not for everyone, for a lot of people. And so that's one simple example, because wheat and wheat products are in everything, at least in the American diet. Yeah. It's one example of where your food to your gut to your brain are highly connected. And so I always encourage people, we talk about this in the book, to do a month gluten-free. And it's not a deprivation diet. There's a million things you can eat that don't have wheat or gluten in them. But it's not about losing weight. It's not about being fit. It's not about looking hot. It has nothing to do with those things. It's about taking away a substance that could be causing inflammation in your body, waiting 30 days, and then seeing and noting how you feel. And a lot of people experience a lot greater clarity and focus and calm, which are things that we all want in our day-to-day lives.
Beautifully explained. Is there anything else that you believe is really important to share with my listeners? Obviously, I encourage them to get the book, reach out to you, and we'll put all those links in the show notes. But is there something, a piece of wisdom or something else that you'd like to cover that is going to help with this hugely important way of approaching our health?
It's also food related, but metabolism and blood sugar and mental health. I think that we've spent a lot of energy and time talking about metabolism when it comes to weight, and metabolism when it comes to certain medications and diseases like diabetes and heart disease and cardiovascular risk over time. But metabolism and blood sugar have a massive impact on our mental health, our anxiety, our depression, our irritability, our ability to sleep well, our ability to cope. If you take someone who's on a high refined carbohydrate, processed high sugar diet, and you take them off of that diet and you move them to a high protein, high fiber, healthy fat, whole foods diet, and they track nothing, not their weight, not their digestion, not even their actual blood sugar, but just their mood and their sleep for a month, the changes will be dramatic. Even more so, a ketogenic diet for some people can drive really profound changes in mental health and clarity. I just saw a paper come out studying this ketogenic diet in schizophrenia and bipolar disorder that just came out of the American Journal of Psychiatry. And the results and improvement in symptoms in schizophrenia and bipolar disorder were astounding on a ketogenic diet. Now, how sustainable it is to stay on a ketogenic diet indefinitely, that's problematic and not necessarily recommended for other reasons, but it just goes to show you how powerful blood sugar regulation and metabolic health are for our brain health and our mental health and emotional well-being.
Absolutely. That's fantastic advice. Well, thank you so much. And where can people get hold of you? Just we'll put the links in the show notes, but where can people get hold of you? And obviously the book's available everywhere.
Books available everywhere books are sold. It's called Prescription for Happiness. It's the paperback version. You can also get it I'll download the audio. Check us out at Parsley Health. We have an incredible newsletter and blog and a lot of free content that anyone can access. We also have a symptom severity score, and you can get your symptom score for free if you go to our blog and just check it out. And it'll help you do that self-assessment online in less than 2 minutes. And it might give you some insights into how you're feeling, which parts of your body are lighting up, and begin to put you on a trajectory to better health. So I highly recommend that. You can follow us on Instagram and Facebook at Parsley Health. And you can find me at all the same things, Robin Berzin MD on Instagram and all the platforms. And it's robinberzinmd.com. I also have a newsletter where I share patient stories and kind of personal recommendations and sort of share my personal perspective of how I'm implementing everything that we do at Parsley in my own life.
I saw that the other day with when you were going on holiday and what to pack for when you've got young children, all the little different things you need to pack. I thought that was really, really great.
It's a mom of 3 who's like all of us, incredibly busy, who's also trying to be super healthy. I call it super busy, super healthy. It's like this thing that we're all experiencing. I'm just trying to share some of the things that personally...
No, it's really great.
There,
That's really great. It's very helpful. And I'm a mother of 4. They're all adults. And I've got 1 grandchild. Yeah. So it was just great to see. Thank you. It was just great to see that. I love that little bit of advice. So it was really great. You're practicing what you preach, which is what I try and do. So I have so much respect for people that aren't just saying do all of this, but you're actually doing it in your own life. And that's very evident. And thank you for the work you do. And thank you for being on this podcast and sharing this information. It's going to be so helpful. And as I mentioned, everything will be all the links will be in the show notes, and all the best with what you do. And thank you again.
Thank you for having me. This has been awesome.
Thank you.